Okay, student. Hi, how are you? Good evening. Today we go over on the lower appendicular bone. Okay, and lower appendicular bone consists of coxal bone, which is this one. The coxal, of course, is like that. Yeah. Okay, coxal bone, right and left. Femur, that's the leg bone. The thigh bone, yes, the thigh bone, long one. And then tibia is a leg bone. Tibia, the leg bone made of tibia and fibula. Okay, together, fibula. And then between femur and tibia is patella bone, which is knee bone, triangle bone. And then foot bone. Okay? Okay, let's go over on coxal bone or coxal bone. Coxal bone or coxae is fused from the three bones: the ilium portion, pubic portion, and ischium portion. Okay? The ilium portion, that's the ilium, pubic, and ischium. Okay? Let's talk about the ilium portion. Which bone marking you see it? The first is iliac crest. Remember we were talking about the transverse abdominalis muscles and oblique muscles. They are origin from the iliac crest. That's the iliac crest. Okay? For coxal bone, how you know this is the anterior side and posterior? How you know? The anterior, when you look on anterior, you recognize the pubic. The pubic bone here is symphysis pubis. That's making two bones together. Yeah, that's making symphysis pubis like that. Okay, here. And the cartilage between them holding the two bones. And the sacrum in the back. Okay, and I show you the model. Okay, let me raise my voice a bit. That's the model. See, the two coxal bone with sacrum and coxal bone in the back, it's making pelvis cavity. That's the pelvis cavity. Where is the womb located? In bladder, yeah? And then the ureter is coming from the kidney. Okay, this is the pelvic cavity. Okay, and that's the femur I'm touching. That's the femur, two femur. Okay, that's the two, and that's the symphysis pubic. You don't see the cartilage, but this cartilage there. Fibrocartilage is very, very strong cartilage. Means this two pubic, this coxal bone, the synestos are joined with the fibrocartilage. And the back is sacrum. Okay? Okay. Let's talk about the ilium portion. The ilium, this is iliac crest. And this is anterior side, which is an anterior side. What bone marking you see? Now you see as the spine. It looks like a spine. Yeah? How you name it? Anterior, superior, iliac spine. And then posterior, anterior, inferior iliac spine. Okay? And then in the back, that's the back side. In the back also you see a spine. Posterior iliac spine inferior iliac spine, greater sciatic notch, which is the sciatic nerve passing through. That's the making notch. Okay. And then you see iliac fossa. That's the iliac fossa. And anterior, you said the posterior portion. Posterior iliac spine, posterior inferior iliac spine, sciatic notch. Okay. These are that I'm pointing. This is part of the SQ. We're talking about that. Okay. And then from inside, the iliac has fossa. That's called iliac fossa. The muscle that inserts is iliac or origin iliac muscle. Okay, iliac fossa and the muscle origin iliac muscle. And in the back of the iliac is also fossa. In some, the gluteal fossa. You can say gluteal. The gluteal maximum and minimum muscle is origin. Okay? Okay. Let's talk about the ischium. That's the ischium. The ischium, you see, like harsh, pointy region, that's called ischium tuberosity. Okay? And then you see spine. That's the ischial spine. And then you see notch. That's the laser sciatic notch. Okay? That's greater sciatic notch, and that's laser sciatic notch. And that's iliac tuberosity. Okay? And then you see ramus. This is the ramus ischium. Ramus means hallway. That's the ramus of the ischium. Part of the, or belongs to ischium. And then pubic. What you see in pubic? You see symphysis pubic. Yeah, that the cartilage. Blue is the fibrocartilage that it's located or origin or make together to symphysis. Okay, fibrocartilage. And then you see superior ramus. That's the superior ramus, or we can say superior ramus and inferior ramus. Superior ramus, inferior ramus of what? Pubic portion of coxal bone. And then you see obturatum, foramen obturatum. That's the foramen, big foramen that the nerve is passing through that, and like femur tibial nerve, okay, that innervate your thigh and your legs muscle. And then on the top you see acetabulum. Okay, that's the acetabulum, which is the femur is article or enter inside that acetabulum or reside. And that's two coxal bone with the femur both sides is making the pelvis or the pelvic joint. Okay? Okay? Okay. Let's talk about, we finished with coxal bone. Let's talk about the femur. That's the femur. Femur is a long bone, and each long bone has the shaft, proximal end, and distal end. Okay? And for femur has its own bone marking. This is the head of femur. You see the head caput? And inside the caput, you see is fossa. That's fovea. And the muscle is screw from the fovea to the acetabulum. If you look inside, the acetabulum has fovea, and that like a screw, that holding. That's why the joint in this, or the coxal joint is very strong joint. That's why you stand. Yeah. If it's that ligament is not ligament fovealis is not there, that break easily or dislocate easily. And the coxal joint is rare. The dislocation is rare. Okay. Then shoulder joint. Shoulder joint, I told you last time, is most the dislocation joint. Okay, because the fossa is not deep, but here the fossa is very deep, and the head of femur is fit completely. Okay, okay, that's the femur. Let's see what you see in femur. You see the head and the neck of femur. Yeah, that's the neck around the head, and then you see greater tubercular trochanter, laser trochanter, greater trochanter, laser trochanter. And between trochanter and laser, greater and laser is groove. Intertrochanteric crest or intertrochanteric line. When you come down, you see linea aspera, which is this one. Linea aspera. Okay? Linea aspera. Okay. And then you see gluteal tuberosity. Okay, these are gluteal tuberosity, which is the gluteal muscle or batic muscle is origin from here. Okay, gluteal tuberosity. And then we done with the proximal end. Let's talk about the distal end. In distal end, you see medial condyle. That's the condyle. That's medial condyle. How you know medial condyle? Let me show you. That's this is the medial condyle because it's facing to the head of femur. That's why this is medial. And this is lateral condyle. Okay, medial and lateral condyle. And then on top of medial condyle, lateral condyle, you see EP. EP means top. Yeah, like epigastric. Yeah? Epigastric region that we go over in chapter 1. That's EP, medial epicondyle, and lateral epicondyle, because this condyle located on the top of greater, this big condyle. Okay, that's the lateral, and that's medial epicondyle. Okay, and then between the condyle is a fossa. Yeah, this fossa is called intercondylar fossa. I'm pointing. Intercondylar fossa. Okay, and then you see adductor tubercle. Adductor tubercle is this one. Adductor tubercle. Adductor tubercle located in the medial, in the bottom part of the epicondyle. That's adductor tubercle. And then popliteal fossa. Why do you call popliteal? Because the patella bone is, okay, as the patella bone is articulate and making that, see, sitting right there. and that's called popliteal surface. Popliteal surface. Okay, that's how I'm pointing. Okay, we finish with femur. Remember, long bone, proximal end, distal end. Proximal end, you see head, neck of femur, 2 trochanter, greater laser, and intertrochanter groove. When you come down, you see linea aspera, okay, and then gluteal tuberosity, okay. That's the proximal end. In distal end, you see what? Medial condyle. This is the back of femur, okay. This is the front of femur. Medial condyle, lateral condyle, yeah, condyle, inter uh, uh, oh, we talk about it, that trochanter. That's popliteal fossa, and then you see the another popliteal surface, yeah, and then you see intercondylar fossa, yeah, okay, intercondylar fossa, and then you see condyle, epicondyle, means the condyle, that's the medial epicondyle, and this is the lateral epicondyle, and the lateral epicondyle there is called adductor tubercle, which is the adductor muscle origin. Okay? Okay, we finish with femur. Let's talk about the tibia. The tibia muscle, this is the tibia bone, and also long bone, both of them. This is both tibia. Okay? One of them right and one of them left. This is the right, this is the left. How you know this is right and left? From the malleolus. Okay? Yeah, this is the right and this is the left. Okay, from the malleolus. Medial malleolus located in the tibia. Lateral malleolus located in the fibula. Okay, we're talking later. Let's talk about the tibia. The tibia, you see two articulation region. That's articulation, which is the femur bone, the condyle set on that articulation. That's what's called articulation surface. Yeah, see the condyle right there is foot and making knee joint. Okay, and knee joint is two condyle of the femur with the two right and left articulation of tibia with the patella. Let me hold it like that, making the joint, knee joint. Okay, and the femur is articulate like that. Okay, like this. See, the femur is not part of the knee joint, but it's helping with the knee joint. Okay, okay. Now you see in tibia we said medial condyle surface. How you see this is medial condyle surface? This is back. This is the medial. Because of what? Malleolus. That's the right malleolus. Ankle, right ankle. Okay? This is the medial condyle surface, lateral condyle surface, and then intercondylar eminence. This is intercondylar eminence. Okay? And when you follow intercondylar in the front, you see tibial tuberosity. Okay, and the tibial tuberosity, the tibial muscle is origin. And that's it. That's the proximal end. Remember, the long bone has shaft, proximal end, distal end. And the distal end, you see ankle. That's called malleolus, right ankle. Malleolus, right and left ankle. See? That's the malleolus. This is the right one. This is the right. If I hold it, that's my right tibia. That's the right ankle. Okay? Okay. Again, I'm telling you, the long bone has shaft, proximal and distal, and proximal end, you see the articulation surface, medial condyle articulation surface, and lateral condyle articulation, and between two, you see intercondylar eminence, this one. Okay? When you follow intercondylar in the front, you see tibial tuberosity. Okay? That's it. This is the tibia. And then the distal end, you see only malleolus. That's it. Okay? Okay, let's talk about the fibula. That's a fibula is a very thin, long bone. And also the tibia bone has proximal end and distal end. Yeah, see, proximal end, distal end. And the most commuted fracture happen here. That bone is thin. Okay, if somebody fall from the higher level to ground, that's break easily. Okay, in a part, in fragment, bone fragments. Okay, this is very serious for people who's hiking, biking, and sometimes the elderly can break easily, but it's most common in youth. Okay, the commuted. We're talking about fracture tendon. Okay, the proximal edge and the fibula, you see the head. That's the head of fibula. And then you see lateral malleolus. That's it. Yeah, because fibula located in the lateral, two sides of fibula. That's why this is medial malleolus in the tibia, lateral malleolus and fibula. Okay, okay, we done with fibula. Let's talk about the leg bones. That's my favorite bones. Okay, the most let's talk about the division first. Okay, that part that I'm showing this, and up to here is called tarsal bone. Tarsals, metatarsal and phalanges. Remember in the hand we said carpal, metacarpal, phalanges. But in the leg bone, you see tarsal bones, metatarsal, and phalanges. Okay? Let's talk about the tarsal part. The big bone is very compact and strong that you're walking on it. This is calcane bone or calcaneus bone, heel bone. This is your heel bone. Okay, that's your heel bone. Okay, that's heel bone, calcaneus. And then you see in front of calcaneus talus. This is the talus. This is the talus. That's calcaneus. That's the talus. Okay? That's the talus I'm pointing. Okay? The talus, calcaneus, talus. And then you see cuneiforms. These are cuneiform. How many cuneiform you have? 1, 2, 3. Cuneiform, medial, intermediate, and lateral. And beside cuneiform, you see cuboid. Yeah, the cuboid is like fourth angle. Yeah, cuboid, like a box. See, is a cuboid. Beside cuboid, you see on the top of cuneiform, you see navicular. That's the navicular bone. I'm going over again the tarsal portion, calcaneus, talus, okay, cuboid, navicular, and then cuneiform. Sometimes you have to number the cuneiform. Cuneiform 1, 2, 3. Or cuneiform medial, yeah, because the big toe is located close to the middle line. Cuneiform medial, intermediate between, and then cuneiform lateral. And this is your cuboid, this is your navicular, this is talus, this is calcaneus. This is the tarsal portion. For metatarsal, these small short bones, yeah, that making your plantar or underfoot bone. And how you count it? Metatarsal 1, 2, 3, 4, 5. The fifth metatarsal is your small toe. Okay? And then phalanges. The phalanges or fingers has 3 bones. Yeah, made of 3 short bones. Except that the hallux has 2 phalanges. Okay? And that's the proximal, medial, distal. Proximal, medial, distal. Proximal, medial, distal. Proximal, medial, distal. And proximal and distal. This is the toe. And the big toe also called hallux. Here is muscle, big muscle is origin. You see it. We're talking about this muscle. Okay? And that's it. The hallux has only 2 phalanges. Okay? Medial and distal. And other phalanges has 3. That's it. We done with the, I hope you enjoyed this video. And next time we're talking about the axial, upper appendicular muscle and lower appendicular muscle. And that's part of your exam, lab exam 2. And lab exam 1 is consists of axial muscle and axial bone. And exam 2 is upper and lower appendicular muscle, okay, and bone. And that's it for today. And have a good night. Be safe and healthy. And see you next week or tomorrow. Let's see. Bye. Bye, everyone. Have a good night.